Okay, good afternoon, everyone. I think that we can get started. Welcome, everyone. My name is Carmelo Rizzi. I'm the president of the European Society for Paediatric Oncology. It's my great pleasure and honor to be here, hosted by MEP Lucas Furlas. And I was looking at the title of this event, which is Championing Children's Health, Advancing Pediatric Oncology on Children's Rights Day, which is a very important opportunity to explain and to point out that pediatric cancer is fully embedded in several areas, which is childhood treatment, diagnosis, but especially this meeting will focus on inequalities. Still, inequalities are a big problem in Europe, and I think that today we have all the stakeholders, including the MEPs, who allow us to enter in this home of the European citizens to discuss with the main stakeholders. I will just give you a few more housekeeping rules because this is an obligation for all of us. Just to remind you that the event is public and will be recorded. The recording will be uploaded to YouTube. Given the great lineup of speakers and time constraints, this is a view-only event, which means for those participating online, questions will not be possible. For those attending in person, questions may be asked during the dedicated questions and answers section. Everyone can take part and follow the conversation by tweeting, posting during the events using the hashtags at Childhood Cancer Awareness, World Children's Day, Child Health. I think that I just want to say that this is my last year of presidency for SIOP Europe. I wanted to take the opportunity to thank not only the SIOP members, but the board and the office and everyone for these 3 fantastic years I have spent within SIOP Europe, and for the opportunities we have had to inside the Parliament and with the MEPs to increase the knowledge, the awareness for pediatric cancer. And let me also thank the parents and patients associations, because this is possible just because we work together. So I am sure that the next president, Uta Dirksen from Germany, will continue this wonderful work. And I thank all the speakers today and all the parents and all the people working around the pediatric cancer, because this is a ride which is not yet finished. We need to go on and to achieve more results. So I am also pleased to give the floor to Anita Kinesberger, who is the committee chair for CCI Europe. And please, Anita, you will go on with the topics of the day. Thank you very much.
Thank you, Carmelo. And I have to say, we're very happy that you will stay as a past president, because we really enjoyed the last 3 years and what we achieved. I want to introduce the program to you today. It's a pleasure for me to be here on a very important day, what will be tomorrow, the Day of the Rights for Children. So, and the program, it will be a very, very important panel, what is moderated by Karina Schneider. And people from the panel are Gilles Vassal, as you already, many of you know, I'm sure, Ruud Ladenstein, Vlad Voiculescu, new MEP, hello, Alexandra Damasch, Andras Kulja, he will give a video presentation, and Delphine Henen, she will be there at the panel as well. Very important policy person for us in CCI Europe. And then question and answer, so we will have enough time to really have this for also questioning things and discussing. And closing remarks by you, Lucas. And then afterwards, a networking reception. Yes, and before I hand over to Lucas, these objectives for today, as you all know, as Carmelo already mentioned, the event advocates for children right to equitable, high-quality healthcare for young cancer patients across Europe. It highlights the importance of cross-border care and collaboration supported by EU policy, like the strategy on the right of the child and the Europe's Beating Cancer Plan. But we never want to forget how much we really contributed to this European Beating Cancer Plan. And yeah, now, Lucas, you are one of our champions. You're an MEP. Everyone knows you. You're a very big supporter for us. I hand over to you. Thank you for hosting us.
Thank you so much. Thank you so much, Amida. Dear friends, dear colleagues, I'm grateful for your presence here, and I'm very touched to welcome you to this event dedicated to Children's Rights Day. Today, with the support of SIOP Europe and CCI Europe, we unite our voices in support of children who are fighting their own battles against cancer, our very own little heroes. This day holds great meaning to me. In 2017, we launched the Little Heroes Foundation, an organization dedicated on supporting children fighting. This foundation is more than just an idea. It is a lifelong commitment for me and for many others. Our goal is to continue supporting these children and their families to keep fighting and maintain hope. Personally, as a member of European Parliament, health issues, and particularly those concerning children, are top in my agenda. The European Union, through its strategy for children's rights, as well as with Europe Beating Cancer Plan, brings us closer to a future where every child, regardless of their country, receives the high-quality care they deserve, whether that child is in Cyprus or in Germany. These actions are not just policies. They are essential tools that enable us to create new opportunities of every child who needs us. We are all here today in this annual rendezvous with a shared goal to continue this fight, securing a future where every child with cancer has access to the health care and support they deserve. I would like to thank my co-hosts for your dedication and all of you for sharing this mission. I'm eager to listen from the experts, from my colleagues, and from all of you. Thank you so much.
I think that now we have the real start of the event, and I would like to ask Karina to come over on our seats and with his hosts to start the sessions. Thank you very much.
Good afternoon, everyone. Thank you all for being here and for joining us for this important day today, this important afternoon. So I think I feel a bit lonely up here. So may I invite my fellow panelists up the stage. So Gilles Roux, MEP Voiculescu, and Alexandra Tamas, if you could please come up the stage to the floor. So we are here today on the International Children's Rights Day. And for us in Paediatric Oncology, one of the biggest mottos and the main objectives is that every child and adolescent with cancer has the right to the best care possible. And they don't only have the right to the best care, but they should also have access to the best care. And I'm very glad that we have the opportunity to discuss this topic today, so the broader issue of access to optimal care. And for this, I'm very happy to be here with my distinguished panelists. And so I would like to start right away with Gilles Vassal, SIOP board member and policy lead in SIOP Europe. So SIOP Europe, and you have led the Ocean project very, very recently regarding organization of care and research across Europe. Can you sum up a few of the most important lessons that we have learned?
Sure. Thank you. Good afternoon, everyone. As you all know, the ongoing European Beating Cancer Plan is building a network of comprehensive cancer centers to be able by 2030 to take care of 90% of cancer patients. This is an important initiative at the European level. But then we said how this will address the needs of children with cancer. And we said that we don't know exactly how care and research are delivered for children and adolescents with cancer. This is why we run the Ocean Project, Organization of Care and Research for Children and Adolescents with Cancer. The first message is, as you may see on this map, there are 385 centers in 37 European countries delivering care for children with cancer. And if we look at the 27 member states, plus Norway and Iceland, not Ireland, but Iceland, there are 282 centers. Interestingly, there is only 18 cancer centers delivering care and research only for cancer patients, adults and children, or children only. And even more, there is only one private hospital across Europe treating children with cancer. So this is the first message. The way the Organization of Care and Research for Children with Cancer is set up in Europe is not superimposable to what is set up for adult cancer patients. And there is a need for specific measures to strengthen this structure, this network, to reduce inequalities across Europe in access to high quality care and research. And interestingly, one additional, the number of centers per country is from 1 to 60. Countries have different sizes. But it's interesting that 30% of these 10 centers, 10 countries have only one centers. And then we ask, how many patients, how many centers are more than 30 patients per year? Which is important because it is considered that to be able to deliver all what is needed, chemotherapy, surgery, radiotherapy, social care, supportive care, and so on, there is a minimum of 30 patients needed. And clearly there are 76%, 3/4 of all centers are able of having more than 30 patients. So clearly the issue of how each patient gets access to all what is needed is a crucial question. And this is why cross-border healthcare is so important, because not each center can deliver high specialized surgery of the liver, cannot deliver proton therapy, cannot deliver autologous or allogeneic bone marrow transplantation. And this is why cross-border healthcare, referral of the patient is so important, while at the same time, for each patient in Europe, the best treatment plan is defined through international tumor board. So these are the key information about how care is delivered in Europe that really need to be addressed by specific measures at the European level. And we have information on the research, but I get your next question probably.
No, please continue.
And the other important information is on the next slide. We wanted to know, is not on the next slide. Okay, I saw there would be a slide. There is none. Oh, that's okay. So that's not, I will describe the slide. We wanted to know if clinical research, clinical trial was available across Europe. And we look at all trials open from 2010 to 2022. And there have been 436 trials. And clearly there is a major discrepancy. And the beautiful map showing that France, Spain, Italy, England, Germany are in dark blue. More than half of these trials were open. Were clearly in Central Europe. There were very few of these trials open in each country. And few countries have no clinical trial open. So there is a huge discrepancy and huge inequalities across Europe in access to clinical trial. The industry, but for sure the academic trial. And this is why we say not all trials can be open everywhere. And this is why cross-border healthcare should also support cross-border access to academic clinical research to be sure that any child in any of these countries can have access to innovation in a timely fashion. And this is why the key message that the cross-border healthcare directive is extremely important, but really needs to be improved further to reduce the inequalities in access to care and access to research. I stop here. Sorry for being long.
No, I think this was a very, very good point for later, a question that I will ask to the colleagues here on the panel. But for the first point, so you mentioned the importance of cross-border healthcare in enabling best practice and high quality care for the children across Europe. So this is why I'm handing over now to Professor Ruth Ladenstein, who is the SIOP board member and the coordinator of the European Reference Network for Pediatric Cancers. So Ruth, we heard Gilles now and also about the outcomes of the OCEAN project addressing cross-border healthcare. So what are for you the most pressing challenges in coordinating cross-border healthcare for childhood cancer patients? And also which policy changes could help address these challenges?
Thank you, Karina. Maybe a first intro, because not everybody may be fully aware on where the European Reference Network for Pediatric Cancer stands. So I think we are very proud that we are present in all 27 member states with 90 members. So I think that's an important message. These centers, comprehensive cancer centers for pediatric cancer, as Gilles pointed out, 90 of them, nominated by the member state governments and approved by the Commission. Yeah, so this is the network that we are able to work with. Where do we see limitations? And I think very nicely, I jump on what Gilles just mentioned. I think we are calling really together for a revision of the cross-border healthcare directive, because it is a beautiful start, but it has limitations. We all know that health is a member state competency, and working cross-border is not as easy as it sounds. Yeah? So what is in our capacity of ERN PET-CAN, we are strongly awaiting now for the patient management consultation system that was completely revamped by the Commission to really embark on strengthening advisory functions. 13 of our specialized centers are ready there with their experts, because very simply, if anything goes wrong in the beginning, a lot of things go on in treatment thereafter. And so that's one point where I think we will improve these scenarios, but it's all about resources. And all the ERNs currently are very much hoping that the ongoing Jardin project will bring more clarity how member states and governments will buy into the cross-border healthcare concept. Because currently it's almost a voluntary contribution, and it's not paying off the hours of personnel in hospitals providing their expertise and their advice, which they obviously want to give, but there are certain limitations in terms of working hours. I think we have brought along with ERN PET-CAN standards of care with a great project with now more than 25 European standard practice guidelines, and that are accessible for all the member states, and are particularly meant to help out to standardize treatments whenever countries are not able, for resource reasons, to really go in more ambitious frontline clinical trials. So the standard is there. We're currently building up registry, which is a big task because there are certain regulations on registries which make them extremely work intensive. But apart from this, I think we need really to thrive towards opening innovation and access to early trials, yeah, because standards we have, but for innovation, I think the borders need to be more open, more fluent, and we need the full support economy-wise. Let me give you one very impressive example. We worked with the Ukrainian patients quite a lot in Europe, yeah, with almost 2,000 children transferred to sites outside of Ukraine. What I enjoyed very much, and I think this is what we need on the national level, are national contact points on the ministry level that help us to look after these patients. Because what impressed me so far after the bombing in Kiev in the hospital, our national contact point provided then a structure for housing of family, for the political status in the country, and finding the right hospital that is able to take care. So when we go cross-border, it's a full package. Yeah, it's not only about medicines, it's about the family and everything that you need cross-border. So I think there are manifold actions that we could envisage for the future on working together. I think we started out beautifully, and I think we made progress indeed, but there is much more to be done. And I think with united forces, we can do so. So I stop here.
Thank you very much, Ruth, for this very comprehensive overview also about what it means actually for a family to move cross-border and also where the challenges are. So you were addressing also early access to early clinical trials and so on. A lot is being done, but we are not where we should be. So with this, and maybe you felt it coming, I will hand over to MEP Vlad Voiculescu of Renew Europe, and also you are a member of the subcommittee on public health and the ENVI committee, and you have been the former health minister of Romania. And when we last met, we also exchanged some thoughts already and experiences on cross-border healthcare and access to drugs also. So as MEP and member of the European Parliament, so how can the European Parliament enhance the cross-border healthcare directive and support cross-border networks such as the ERN PETCAN to address some of these challenges?
Thank you so much. Thank you for having me here, and above all, thank you for all your work. I feel honored to be among you, and also I feel honored and pretty enthusiastic to be able to work with you over the next couple of years for the benefit of children diagnosed with cancer. I'll just say a few words on my person, just to lay the ground here of my motivation and my capabilities to help over the years to come. I'm initially a banker, which is a funny background for somebody who's been active in health for the last 15 years as a patient advocate first, and also as somebody who's was a witness of the phases of suffering with many children with cancer in Romania and Moldova. I've also been a health minister, as you mentioned, in my home country in Romania for 2 terms. And now in the European Parliament, definitely my focus is health, and I'm the coordinator for the Renew Europe political group here in the Parliament. I'm happy to confirm that the subcommittee on health is going to be a full committee, hopefully by year's end, but if not by year's end, then definitely at the beginning of next year. It's a done deal. This means that you will have dedicated MEPs that will work on everything that has that is related to public health, like pharmaceuticals, medical devices, and all the programs from EU for Health to all the rest. Then there's going to be an intergroup on cancer and rare diseases. Some of the people here, thank you, Mr. Fuelas, and also thank you for gathering us here. We have already over 80 MEPs who signed up. We are in cooperation with, we cooperate with SIOP, who will have the leading role, obviously, for everything that is related to kids with cancer. And I would love to say a few things on the great progress on what we already have, and lots of things have been mentioned already by Mrs. Ladenstein and Professor Gilva.
Call me Gilles.
Call me Gilles. Earlier. So I think we have a great progress, actually unprecedented progress with the disease over the last couple of decades. If we look at survival and quality of life, we already have a network, an impressive network of 90 members. We have an IT system, a European one, which is not a small thing. If we look at other pathologies, we do have an amazing organization, two amazing organizations, SIOP and CCI, who are coordinating everything. And I think there's a very good ground to work on. And now I'm coming to your question. There are a couple of things that I think we can help with in the Parliament, and a couple of things that are unacceptable for me personally, and for a majority of my political group, and I hope of this Parliament. The cross-border healthcare directive is already 13 years old. We have several implementation reports that show, the last one from 2022, that show that although this has been implemented in all countries, implementation is not the same. We need enforcement there. We need to look at how countries have implemented the directive and if things can be improved. We have barriers related to bureaucracy. We have financial barriers. In plain words, people need to travel. People need to get the information first to get to have the necessary treatment for their kids. We have a terrible barrier on everything that is related to clinical trials. I don't think it makes any sense for the industry or not even for healthcare services, not even for insurances. Does it make sense to have these barriers? Not to speak about the patients who would be given a chance. So we need to look at that. I have discussed this with the potential next commissioner, with Mr. Oliver Varhelyi. While the revision of the cross-border healthcare directive might or might not be at hand, we will definitely continue what has been the work on the Beating Cancer Plan. Funding for the ERNs and for the joint actions will not only not decrease, but it will increase. The ERNs might actually be expanded. and this is something that that has also been confirmed during the hearing on my specific question. And there's also a timeline for that, and that's over the next 12 months, discussing ERNs and discussing various actions that can maybe not modify the cross-border healthcare directive, but to supplement and to maybe to enhance cooperation and to make traveling and to make logistics simply easier for families with children. What is also unacceptable for me is that we do have pharmaceuticals, medicines that are not able to be used that are not being used for children. The pharmaceutical package, especially the directive that is now in the revision of the Council, also sees several additional arguments for the industry to develop more pharmaceuticals for children. There's this voucher system. I'm having talks every day on this particular topic. I do hope that we will have a mechanism that will ensure that more medicines are developed for children. And I do hope that in the national legislations in Europe, there will be room also for their use, even before we have a European legislation for that. I will stop here, and I'm very happy to answer any question.
Thank you very much for this overview also about the conversations that you had. So this sounds also like a full agenda, I would say. And before I pose my next question to the next panelist, I would like to first look at Ruth and Gilles if there are any immediate reactions from your sides.
No, I think the fact that the Parliament with the Commission is looking at how to make the cross-border better work, even though it's not yet revised, is extremely important, because we know that the revision takes years and we need actions now. And the key point is how this improvement can be really set up in the next years, really to make things happening for the patient. So I think really your support is extremely important. And we are very keen to provide information even more in detail to what we did, really to show the real life, especially access to clinical trial, academic clinical trial abroad. That is extremely important. We need to give the possibility for each child and adolescent in Europe for whom the treatment, the standard treatment failed, to give them access to innovation and research. And at the moment, there is really a hurdle, and really, if this hurdle can be really addressed and alleviated, that would be really great.
I continue to compliment with a little bit of a different aspect that usually Gilles loves to talk about.
I'll let you do.
Thank you, Gilles. This is drug shortages.
Sure.
Yeah? Which is a major problem. And when we are rolling out or providing European standards of care, in our registry, we also ask the questions, have you been able to deliver? Because we do know that even for standard practice care, we have drug shortages, major drug shortages. And there are many reasons behind it. And I dare now to be a little bit provocative, and the magic word for this, in my vision, is parallel trade. Even John Ryan, when we were sitting on the Cancer Mission Board, we were discussing this topic. It's a hot topic, but we know that parallel trade is one of the causes in widening countries why there is limited access to drugs that actually are provided by industry. And I think this is really a topic to be looked into because we need to have this availability and access to drugs, obviously to innovation, but also what we consider drugs necessary to deliver well-established standard of care. And if we cannot manage this, the outcome is simply worse. And this is the major inequality that we see when we look in outcome data across Europe. Thank you.
Yep. So it was for years when I was a banker in Vienna that I've been buying medicines at the Internationale Apotheke in Vienna and sending them over to my home country. Some called me a trafficker because I was doing that, but otherwise there would be no possibility for kids with cancer to get medicines like vinblastine or dacarbazine or cosmegan. By the way, it was not further than last week that a friend of mine bought cosmegan from the UK and brought it over to Bucharest, not to some funny small clinic at the end of the world, but in Bucharest, in the capital of my country. So yes, there are still shortages, and I find it, I will use the word beautiful, that you have a register where you have the specific question and where you see that one of the probably the most frequent cause for not being able to deliver the standard of care is shortages, because for many, many years, among many countries in Europe, governments would not even recognize the problem. And if you talk about around here, 7, 8 years ago about shortages, this wouldn't be a topic. In the meantime, we even have this problem in big countries. We even had, during COVID, we had this problem with lots of medicines. So right now, there is a common understanding that this is a problem, and there are various ways that we can address it. There will be, there are lots of acts, directives, and regulations that some of them are just, somebody was telling me the other day, like songs where you know the music, but you don't have the lyrics yet. So everybody talks about the Biotech Act and the Critical Medicines Act and all sorts of, and we all know that the Critical Medicines Act should address the problem that you've mentioned. So, and this can be done by ensuring more production, the production that is done in Europe, ensuring supply chains that are not dependent on China primarily, that supply chains that can survive even economic conflicts or political conflicts. You can also have stocks, and it's very important to have a mechanism in Europe that is overseen by the EMA, ideally, and for not only joint acquisitions, but also for identifying shortages and addressing shortages as soon as in a reasonably timely manner. These are some of the things that is being worked on.
Thank you very much. And so I think this is the moment to introduce Alexandra Tamash, who is the Director of Public Affairs in FPA. So I have my question for you, but in case you want to directly, react to what we have been discussing, please go ahead.
Actually, thanks a lot, and good afternoon, everyone. It's really a pleasure and an honor to be part of this distinguished panel and speak about a real important topic at this really important moment in time politically. I think I'll touch upon a few of the points that were already raised in my intervention, as this flows very nicely. You chose a great panel today, actually. We complement each other. We will complement each other very well. So as I was saying, we believe that we are at a very important moment politically. we expect a new College of Commissioners as soon as the Parliament will vote on the new college. There are new political guidelines. We have mission letters for the commissioners we've just heard, and it's great to have the confirmation that there will be a dedicated health committee with full legislative powers in the Parliament. So we believe that this is an important moment to take stock of what the EU has in place and what it can do more to address and to deliver on the expectations of the citizens, because what has been constant throughout these years is that citizens expect the EU to do more on health. So now is the time to actually be ambitious and break down the barriers and achieve real progress. And we can only achieve real progress by sitting together, having an honest conversation, dissolving the regulatory silos that the EU is so maybe skilled at putting in place sometimes, have this proactive dialogue, because we are here to meet the needs of today's patients, but also tomorrow's patients. And the FPA has been asking EU policymakers throughout this year to work together with the industry to create the opportunities to once again make Europe the best place where research and innovation can happen in pharmaceuticals, regain its status of world leader as we were 20 years ago. We are very pleased that the Draghi report recognizes the strategic importance of our sector. It takes a holistic view, looks at the challenges, but also the opportunities, talks about harmonizing the regulatory environment and streamlining practices so that we can deliver and break the silos, as I mentioned, not have a fragmented life science ecosystem in the EU, because that is of strategic importance. I would like to focus on two areas where the EU can do more to improve access to innovative medicines for patients, but especially for children living with cancer, and where collaboration is actually key at this particular point in time. There was a lot of discussion on clinical trials. That is my first point. We really need to enhance the clinical trials ecosystem. There are currently barriers in place to participate in multi-country clinical trials, and we really need to remove those barriers because borders should not be in the way of when it comes to patient access to clinical trials. I think it's useless for me to say how important clinical trials are for patients and healthcare systems, but I do want to add some data. Clinical trials can ensure earlier access or the earliest access to new medicines, sometimes even 5-10 years before they are launched on the market. And European healthcare systems can benefit up to 1.5 billion euro from clinical trials because these clinical trials cover payments and have savings for other drugs. However, when it comes to clinical trials, we have to look at where we are now. FPA has recently launched a report, and we found that in the last 5 years, 60,000 European patients have missed out on clinical trials. And there are a few reasons for that. But if we are to look at where Europe stands in the global clinical trials landscape, the EU's share of global clinical trials has halved in the past decade, even though clinical research at global level has increased up to almost 40%, but Europe is going down. When it comes to pediatric clinical trials, both commercial and non-commercial clinical trials have declined over the past 6 years, is what our report shows. And especially commercial clinical trials have fallen by 4%. But also on the academic side, there are 11% less clinical trials. So this decline really suggests a systemic challenge. We need to address the problem from multiple angles. But I'm not here to paint a dark picture. Not all is lost. We can reverse this trend. Some EU countries are already doing it. Our report shows that Spain can be seen as a success story. In 2023, actually, Spain overtook Germany as the country where clinical trials start, where more clinical trials start. And Spain has been increasing its, actually being able to attract more clinical trials every year, 6% more every year. And of course, we need to look at the ecosystem that Spain has created with the speedy implementation of the clinical trials regulation, increasing capabilities, infrastructure, and a private-public academic collaboration model that actually works. But if I were to look in our side of Europe, CE, Poland is doing really well as well. So we have examples of best practice and learn from them. FPA has also is not just here to criticize and stand on the sidelines, but together with the European Forum for Good Clinical Practice, we've launched the EUX Clinical Trials, Cross-Border Clinical Trials Initiative. This is a multi-stakeholder platform that looks at what are the issues, the challenges with cross-border clinical trials, multinational, multi-country clinical trials, and make recommendations. We had the first meeting of the stakeholders in Brussels in April, and we're finalizing the recommendations toward the end of the year. So we hope to put something concrete on the table to the Parliament and the next Commission. So I focused on access to medicines before they are approved at EU level, but I do want, because a lot of the conversation has been also about medicines that receive EMA approval and stand ready to be launched in the member states. So we of course acknowledge that there are inequalities. FPA has been publishing every year the FPA patient weight indicator. This is a report that looks at the number of days a patient has to wait after marketing authorization for a product to receive a product. And it's a huge discrepancy between Germany and our home country, Romania. And because we are not only, as I mentioned here, to take note and criticize, FPA companies have committed 2 years ago already to submit for a price and ask for reimbursement across all member states, all the 27 member states, within 2 years after marketing authorization. We advocate for a pricing system that matches the ability of each country to pay for the respective medicine. And we are also committed to making pediatric medicines available wherever there are actual patient needs. And where the infrastructure is in place, because we've heard Professor Vassal talk about also the inequality in infrastructure. We are part of the Critical Medicines Alliance, looking at ways to solve supply issues and mitigate shortages. So we are really ready to define together the lyrics of this song. I do want to just mention that the innovative medicines are responsible for just 4% of the shortages that take place in Europe. But we do want to make our contribution to this debate because there's no point in having an innovative medicine if it's not available to patients. And we also welcome the EU HTA. I think this is one of the low-hanging fruit, where the EU and industry and academia can collaborate even better because time is ticking. All in oncology and advanced therapies will go through a joint clinical assessment on the 12th of, starting the 12th of January, 2025. And as it currently stands, the current HTA system, instead of being a facilitator, risks actually slowing down access to innovation. Early engagement with industry, sufficient time to create the dossier, as well as broad evidence requirements are really needed to make the UHTA work. And time is running out because 12th of January is just around the corner. So to conclude, and I hope I haven't taken too long, but to address some of the points that were raised, we have been calling for a high-level forum to discuss access. We stand ready to and our members are providing us with recommendations, with solutions, and we stand ready to put forward those viable solutions to you policymakers. And we think that the time is really now. Thanks so much.
Thank you very much for this fierce presentation of what FPI has been working on to improve this situation. And I heard to my right that there is also a comment.
Sure. Well, thank you. I just want to go on the issue of access to medicine. Of course, access to medicine does not summarize access to high quality care, but this is an important part. And we need to understand we have three different topics. The chemotherapy, which is used in all, for the treatment of all pediatric malignancies, 70% of what we use, which is off-patent generics. And the issue is shortages. And we showed that the lower the GNI is in the country, the higher the number of shortages is. And this is published in Annals of Oncology. The second is access to the clinical trial, which is for children in relapse, having access to a medicine. We don't know yet if it works, but giving the hope and the possibility to have access, and we discuss it. And in the middle, we do have the new medicines, not enough, but which are approved at the European level, centrally, for the treatment of pediatric malignancies. And we have a few over the last years, and some of them are really active. And the issue is, at the moment, these new medicines approved centrally in Europe for all countries, are not available for each child in each country. We are talking about CAR T cells. It's a huge debate and a huge complexity about CAR T cell, but CAR T cell is not yet available, the one sold by companies. We're talking with other antibodies to treat leukemias. And this is important. This is why we believe that one of the proposed measures of the revised pharmaceutical package, which is under discussion at the moment in the Council, after final discussion and voting in the Parliament before the election.
Not final, there's a trial.
Oh, well, of course, but well advanced, well advanced. Clearly, there is one measure which is, we believe it's important, is equal access. And for us, equal access to new medicine is absolutely needed in the next years. And this is why these measures, which still in debate, is important. How to incentivize companies to launch their newly approved medicine in all member states, the member states willing to get, and how we can improve. We showed in SIOP Europe, taking 3 medicines, that clearly the time from approval at the European level and availability in the country runs from 70 to 700 days, too long. And then the way the drug is available is not the same in each member state. So I think this is the third part of access to newly approved medicine that can really change the life of children. This is important to address through the new pharmaceutical package being still in negotiation in a way that things will be improved in the next year for children.
Thank you, Professor Vassal. You're right. We need to look at access, availability, affordability, inequalities. We have the numbers. We totally agree. Do we agree that the pharmaceutical package will be that magic bullet that will solve access? I think we both agree that it will be not.
No.
That magic.
We don't go for a magic. No. We need something improving from where we are.
Absolutely. We also need to look at the root causes of the lack of unavailability and access. And you mentioned CAR T. That is a highly advanced therapy that needs the appropriate infrastructure. And we know in our home country, Romania, how long it took for the leading children's hospital to build up that infrastructure to be able to then deliver the product. But that's why the high-level forum that FPA has been calling for could be that environment where we could look at the different issues, challenges, and find the right policy options, the viable policy option.
We don't think that one measure in the new regulation will change everything. But clearly we believe, and we have several asks about how to improve this for pediatric medicine, we believe that this revised pharmaceutical package can really facilitate a few things. But you are absolutely right. There is not one solution that will fit all, one size fits, one solution fit all about access. CAR T-cell is specific. But the point is, CAR T-cell at the moment is not accessible for all children with relapsed leukemia in Europe. Not.
If may I complete that sentence, and this, the fact that it's not available, it's not only a problem of a child or a family in a certain country, it's also a European problem. So, and we should address it as such in this House, with the Commission and with the Member States. It's a European problem.
Thank you for making this point, which is actually the perfect slide over to our final panelist. And I'm very happy to welcome Delphine Hinen, CCA Europe Committee member and our European Affairs lead and founder of Kick Cancer. So from the perspective now, from the patient community, what is your take?
So thank you very much for giving me the opportunity to speak on behalf of patients and especially children and young people with cancer. In terms of access and improving the chances for all patients with cancer, we really wanted to shed a light specifically on cross-border health and the current cross-border health directive. So I am the mother of 4 young men, one of whom was diagnosed with cancer in 2013, so 11 and a half years ago. He passed away 3 months ago, not because of a lack of access to the right treatment center in the right country, but because the right drugs or the right treatment didn't exist to cure him, but it's something we talk about really often. But his treatment journey extended beyond Belgium, and as it should be, or at least the opportunity and the chances should exist for rare diseases and complex medical conditions like pediatric cancer. And so I want every child in Europe to have the same opportunities as my son Raphael had in terms of traveling for the right treatments. And that's why I want to speak about all young European patients diagnosed with cancer who sought treatment to benefit from cross-border healthcare. And so I'm going to tell you the stories of 4 children. They're a bit fictional. One of them has no country mentioned because we don't want to be too controversial. But I will start with Nico's story. He's a 7-year-old boy from Athens. He's a fan of Olympiacos. He plays soccer himself. He played soccer himself until he was diagnosed with Ewing sarcoma, which forced him to stop all physical activities to undergo an intensive treatment. So after 3 cycles of chemotherapy, a surgical removal of his tumor, his doctor recommended proton beam therapy, which is not available in Greece. And so an S2 form was issued, allowing Nikos to access treatment in Germany. This phase of care will last 6 long weeks far away from home. Nikos has a 3-year-old sister, Eleni. And so they're very attached to each other, and they both need their parents, particularly under the difficult circumstances of Nico's illness. But so the current system in Greece and in many other European countries involves that the travel expenses are covered for one caregiver, not for the entire family. And so how shall we best support this family through the psychological challenge of a relocation? And we think that several measures are essentials. The parents must alternate at the bedside of the child. One parent alone would just go completely bonkers, spending 24 hours a day for 6 weeks in hospital with his or her sick child. Eleni and Nikos both remain to be in contact with both their parents. And so either the parents must have the option to travel back and forth between Germany and Greece, or the whole family must be able to relocate in Germany for 6 weeks. Today, none of this is possible without the intervention of philanthropical organizations. And so we should normalize that in the directive. It should be possible for all patients and not just for the patients who have a good associations in the either originating or hosting country. Now, I also want to tell you about Lena. Lena is from Krakow, Poland. She goes to the park every Sunday. She goes on the little boats in the pools in the park. But then she was diagnosed with ependymoma. It's a very aggressive brain tumor. And after 1 year of treatment, she relapsed, and a Mehmet treatment was recommended. It's a treatment where we starve the tumor by blocking the growth of the blood vessels around the tumor. This treatment is not available in Poland. It's not even reimbursed in Poland, let alone. And so for that reason, an S2 form will not be issued in Poland, although there is scientific evidence that a treatment is the right one. And so a Polish foundation will pay for the treatment for Lena. But the treatment lasts 2 years, and it's a very significant financial and administrative burden for these patients. And so there are a lot of problems that are not being tackled today. So who will help the parents to have access to the actual understanding, of German, because there is no translation provided for when patients travel, or not easily. So fortunately now AI might help part of it, but we still need the human touch, when we talk about very significant treatments. The family in this specific case, they failed to register their stay in Austria within 4 months, and so they incurred a penalty. We forget that. We are all EU citizens, but when we have to relocate for 2 years, we have to register in the whirlwind of a very heavy treatment that can go, off the radar. But the very complex part is Lena's family relies on a lot of social security support from their home country in Poland. If they relocate in Austria, they will lose the social security support, but they will not get it in Austria because it's actually a requirement for their relocation that they don't rely on social security. So it's a bit of a catch-22 situation that also needs to be sort of provided for in the cross-border health directive to, avoid this administrative doom loop. Now we come to our countryless child, Dimitar. He's a 9-year-old boy. He has a brain tumor, a low-grade glioma, which prevents him from keeping on playing violin as he used to. And now he has to undergo surgery for his glioma. Surgery is one of the major aspects of the treatment. It's the one that, is really the golden bullet to improve survival chances and reduce toxicity, long-term side effects. And so this key step in the treatment, you really want to make sure that it goes, in the best possible fashion. The surgeon really wants to, in his homeland, really wants to perform the surgery because it's a way for him to keep on learning. But he doesn't really have that much of a experience in the treatment. Of course, we could go on to sort of overall discussions on how to improve experience in the home countries, and that's really something that needs to happen as well. But now we really want to focus on Dimitar and making sure that he has access to the best surgeon at the very moment he needs it. The problem is, because the surgeon wants to perform the surgery and will not necessarily admit that he doesn't have the right track record or build up experience to perform the surgery. It's also difficult to ask the surgeon to issue the S2 form. And because it's also difficult because if they don't end up having the S2 form, the surgeon will perform the surgery. And so you want to keep a very good relationship with the professional who may ultimately treat their child. So we need to ensure somehow that there is a forum where patients can discuss the possibility of a treatment abroad with a neutral healthcare professional whenever that is needed. Let me finish now with a story from Belgium. It's a patient I've been following through my activities at Kick Cancer. I want to tell you about Lotte. She has a neuroblastoma. She's 12 years old. She was diagnosed in 2020. She relapsed in 2024, despite a significant and extremely heavy treatment that took more than a year. So her hair had regrown. She was finally happy again in school, and now she's back to square one with treatment. So she has been through quite a few treatments since the relapse, and her tumor is shrinking beautifully. We know that the treatment that has been given to her right now will not make it disappear completely, and it will not offer her the chances of a complete remission. So what Lotte needs now are CAR T cells in Rome, anti-GD2 CAR T cells. There was a phase 1 clinical trial that was completed in the Rome hospital, and it's not available anywhere else in Europe. And to get access to that, you also need the S2 form, because the Belgian authorities will not grant it. If she had been from the Netherlands or Denmark, she would have received the S2 form. So there are discrepancies in how countries approach what is innovation, what is new treatment. And there are scientific publications confirming that it's the right way to go. To add pain to injury or insult to injury, if the treatment had been an innovative drug developed by the industry, as we would hope for, also for children with cancer, there would have been access through a hospital exemption, through the compassionate use program, sorry. But because there is no commercial interest in developing certain drugs, especially CAR T cells, by the industry, because we know it's not profitable, this drug is developed under the hospital exemption. And so there's actually no one paying for the manufacturing of the drug between 2 cycles of clinical trials. So we're also in a catch-22 here. We can't get access to the free drug under a compassionate use program, but also we can't have an S2 form to have the patient travel and go to Rome. So it's not fair that patients, don't have the same chances depending on where they live, because S2 forms will be issued in certain European countries and not in others. And it's the situation for the hospital exemptions, but also for clinical trial. For clinical trials, Belgium is very strict. We do not grant S2 forms. Other countries are much more lax, and they do it. And we think it's fair, because in very rare conditions, clinical trials shouldn't open in every single country. And so we should really make it possible to allow the S2 forms for clinical trials as well. And so we really need improvements in the cross-border health directives to ensure better outcomes for all pediatric cancer patients. And so in short, travel costs should cover entire families or allow multiple trips so that parents can alternate by their child's bedside. Tailored support should address psychosocial needs of patients and their families, but also we have to simplify administrative procedures to make it possible for families to relocate, sometimes for a really long time period. S2 forms shouldn't depend solely on the judgment of one doctor. Decision-making should involve neutral healthcare professionals as well. And S2 forms should explicitly allow for travel for clinical trials and innovative treatments, especially for rare diseases. And with these words, I want to thank you for your attention. I know that the directive has already helped a lot of patients and brought a lot of progress, but I think that the time is right now to further improve it and make sure that more children with cancer can, access the chances that they deserve. Thank you.
Thank you very much, Delphine, for sharing this, in fact, real experiences from families that we have collected from our community. And I think, so sitting up here, we go and we discuss big words like cross-border healthcare directive, pharma package, access to this, access to that. But in fact, we rarely talk about the real impacts in daily life that these things have to families who have a child with cancer. So thank you very much for this. And Gilles, you want to say something?
If I may?
Absolutely.
Thank you very much, Delphine, for I just want to highlight your last example. This is an innovative treatment which is under evaluation. It's not yet approved. It's a clinical trial, and it's open in only one city in Rome. And clearly, in this setting, for a patient, and this is an academic trial, it's not an industry trial, because often the industry is paying for traveling. It's an academic trial. In this situation, then it depends on how, in the country, the insurance of the patients and the family accept or no to pay through the S2, the access to cross-border. And this is a discrepancy you are describing. In Belgium, there is no such called S2, while from there are other. So inequalities in access. And clearly working on this concept is extremely important to exactly take your point, which is how to provide the opportunity for children with relapsed neuroblastoma to get access, if they are eligible, to a clinical trial, which is open, an academic trial in only one center in Europe. This is a good example of how we can really work on making better.
I have a very short remark, and I think some things we can work through the European Parliament level, but I think when we go into the health issue, we really need the member states, the council, that are getting deeply involved, because here we are really strictly talking. Some of the problems come that health is a competency of the member states, and the member states are not aligned. And this has, even though there is good legislation in place, it's implemented in a very different way. And I think this we have to keep in mind, that there's a huge work to be done on the member state level to align in a better way. Yeah.
But the directive on cross-border health could be turned into a regulation to reduce the discrepancies on certain aspects. I mean, depending on the tool you use, of course, we have to see if the European Union has the competence to issue a regulation on the topic, or at least the directive could be more specific on certain items, such as the clinical trials, such as how travel expenses are being reimbursed. Because for younger patients, except for situations where the patient needs to travel for a really short procedure, there's no way that covering travel expenses for one caregiver will do, because you're dealing with a family, you're dealing with people who need to go together with our child.
And actually, this is what we discussed before. Transforming the directive into a regulation will take years. And clearly, as you mentioned, Vlad, clearly, how can we improve the current legal system to make it better?
Thank you. Delphine, I'm really sorry for your loss. I have a 10-year-old son myself, so I can only imagine the pain that you're going through. You mentioned commercial interest of pharmaceutical companies in developing pediatric medicine. And I just want to mention that under today's regulation, the pediatric regulation, there is an obligation for companies to test medicine if they work in a pediatric population. So that's an obligation. There is an incentive attached to it. There's an additional period of protection, but that obligation is in place today. And actually in the revised regulation that is under discussion, negotiation in the council, and will come back to the parliament and the trilogues, the obligation is even more enforced with waivers, limited waivers, and strict rules in place. But that the obligation will still be there, even if it doesn't make sense commercially. In some areas, we lack scientific knowledge to understand the disease. So there are white spots, and companies would want nothing less than to find the perfect treatment or the perfect cure, but the science is still not there. We recognize that this is an issue, and FPI has launched a rare disease moonshot over a year. MEP Voiculescu actually spoke on a panel at the anniversary of the moonshot, because we bring companies together with the academia, private-public partnership to find and break those scientific barriers so that we can actually advance research into rare disease and pediatric medicine. But in some cases, the science is still not there. So that's something that we need to solve together. Thanks.
Thank you, Natasha. Let me build up on this.
Alexandra.
Oh, sorry, Alexandra. Let me build up further on this. I know that the pediatric medicines regulation current scheme isn't working in pediatric oncology, but it's going to be reinforced, hopefully thanks to the new pharmaceutical package. The reason why my son never had access to the right drugs is not because this pediatric regulation wasn't effective enough. My son had a type of cancer, which is a soft tissue sarcoma, which doesn't exist in adults. And the driving mutation in his cancer is very specific to this type of pediatric cancer. It's called PAX3 FOXO1. It's really that mutation that we need to drug in order to give him a chance to cure. Indeed, we have now the understanding that this is the sort of driving mutation in this disease. We don't know yet how to actually approach this mutation to drug it. But there is also a significant lack of funding in very basic research in pediatric oncology and in translational research in pediatric oncology. My organization is fundraising to actually fund research. We will never have the actually, euro power that major companies or that states can have. And there is a cycle in the fact that because there is no commercial interest today, because we know that it will never be profitable to sell a drug for my son's disease, even though young patients will keep on dying from that disease. So we need to develop a very, very strong moonshot. And I'm glad to hear that you're doing that, but we have to be very intentional of that to make sure that not only do we fund the basic research, the translational research, but it's really at the clinical stage that afterwards you need a lot of money, and we need the industry to stay intentional in continuing to support patients in those disease areas in a way that will never be profitable for the industry, but in a way that will only, reach a social, a societal impact, which is to cure patients who today have no chances of getting better.
So, if I may, this is important because the progress we made over the last 20 years in understanding the biology of pediatric malignancies is absolutely huge. PAX translocation, PAX3 translocation in soft tissue sarcoma is very well characterized. We know a lot about it. What we miss is a drug to target. And for sure, most of the company will not embark on this because it's a very rare target in a rare disease. So this is why we are calling in the revised ongoing revision of the pharmaceutical package to have an incentive for first-in-child marketing authorization, which is, can we incentivize small company, biotechs, who will embark on developing an antibody or a drug to target PAX3 in the soft tissue sarcoma that will really be incentivized, increasing the capability, because we cannot expect that the big pharmas, and I will not mention them, will address all the very specific different rare disease that we do have, because we have many. And it's not only for rare pediatric cancer, it's true as well for rare pediatric disease. So there is such a first-in-child incentive in the US. Can EU insert into the regulatory package a first-in-child incentive? It doesn't make sure that it will solve everything, but at least there will be incentive for small companies or even medium-sized company to embark on the development of PAX3 inhibitor. And this is one of the requests that we put forward in the council, in the parliament for the amending of the proposed revision of the regulation.
So, and this is now the bad thing about being a moderator, because you have to at some point stop very, very important discussions. But so I hand it over now to MEP Voiculescu. You wanted to comment.
So my answer is obviously yes, and I'm gonna be the rapporteur for my group on the directive. So I think the Renew group will definitely support that. And we did have EPP here, and we did have Tilly Metz just coming in, who's the vice president of the SAND committee. So I think we're gonna get support from the parliament on that. But we should work on council as well. Now, the cross-border healthcare directive, its modification, what I've been told every time I brought up the issue is that if we open it, it might get killed by the member states. So we might want to be cautious about opening the discussion, and we might want to be very intentional about what exactly we want to propose and how those things that we would like to see in reality are first piloted and then made, and then that we have a lot of publicity for that. So for me, I'm coming from an NGO and the bank. I would think of a pilot project where we have a fund, a budget for the logistics, for the accommodation and the transportation, and for the missing information. I think for kids in Greece or Romania or Cyprus, I think the first thing you need is the information. Can you just talk to your doctor, or as it was mentioned earlier, is there anybody else you can get an advice from to see if there is a solution out there? So I think we should seriously consider with the new commissioner building on the ERNs, building on what we have, looking at the problems that have been amazingly nicely explained earlier of what families are going through. And as soon as we have something working, look if we can put that in a directive, in a regulation, or in or maybe also in discussions that we do from a European level with the national governments. Might be that as the Netherlands has a different understanding or different interpretation of the directive than other countries, maybe we can look at that and then do that from the Commission level, from the Parliament level with the member states.
Thank you very much for this. And so I'm so sorry that I need to close this panel, but we are already over time. I'm a bad timekeeper. But so from my perspective, some of the key, I don't know if it's takeaways, but things that stuck out from me from the panelists. So I think we heard today that access to high quality treatment, care, and access to innovation and medicines is a European problem that needs to be treated as a European problem. Time is ticking, not only in terms of timelines that are coming up to revise things, to discuss things on the European level, but time is ticking actually in the lives of the children who do not have access to the best care. We have heard that standard drugs are not available to every child with cancer, let alone are innovative treatments for children. Cross-border healthcare is a facilitator for access to the best quality care, but also this is not available to every child with cancer for many, not only, but also bureaucratical reasons. And then we need specific actions now to make improvements for these things. And what I heard now from you, Vlad, is that actually your recommendation to tackle with the new commissioner the ERN issue, because can we wait for a revision of the directive or not? And also the cross-border challenges, and then tackle these issues with the member states. Is there any last words from any of the panelists to close this? Okay,
You had a
then.
question there.
Yeah,
No.
no. And yes, the video, yes, because unfortunately, I think Lucas Fuller had to leave already. You close, okay. So, but then here, yes, the video.
Dear
yes,
colleagues,
indeed.
I am honored to be invited by SIOP Europe and Childhood Cancer International Europe to participate in this crucial panel on Children's Rights Day hosted by my dear colleague MEP Lucas Forlas. While I regret I cannot join you in person, I'm deeply committed to supporting our collective mission of advancing pediatric oncology across Europe. As both surgeon and a member of the European Parliament, I recognize the significant health challenges of our children faced in pediatric cancer, which remains the leading cause of disease-related deaths in children and adolescents across Europe, within approximately 35,000 new cases diagnosed each year. Yet, despite this alarming figure, inequalities persist in access to treatment and quality of care. These disparities can vary widely depending on where a child lives within the EU, or creating significant gaps of survival and quality of life across Europe. In Hungary, we have achieved a significant survival rate above 80% for childhood cancers. We are facing a harsh reality. Rural regions, lower income families, and those requiring cross-border care often face obstacles that delay diagnosis and complicate treatment pathways. Our healthcare system across the EU must work to bridge these gaps, ensuring that all children have timely access to advanced treatment, specialized care, and ongoing support. Europe's potential for cross-border collaborations is one of our greatest strengths, but we need a more robust commitment to harmonize standards and resources across all member states. We need to reduce administrative barriers, increased funding for pediatric oncology research, and collaborative network of specialists across the EU. Thank you to everyone here for allowing me to share this message with you. Together, let's continue working towards a Europe where every child with cancer has an equal chance at survival and equal chance at hope and commitment to health equity. Thank you.
So the good news is, I just spoke and we are not that much over time, so we do have also some time for questions from the audience. Yes, yes, and welcome to Tilly Metz is very, very good. So we saw you already before, but then you had to leave, so welcome back. And thank you for joining this event. So is there any questions from the audience too? Yes, please go ahead. Could you? Yeah.
Thank you for letting me ask the question. I was really interested in the talk, in the presentations. They were excellent. I'm from the UK, but we face exactly the same problems. And I suspect if we had North American individuals in the audience, they'd say exactly the same. These are prevalent issues in our world, and we really need to work on this together. I am wondering about the barriers to research. My specific question is, how do we de-risk research? Vlad mentioned the voucher system, which I thought I'd heard about. I thought it was quite interesting in terms of transferable, and whether there's an appetite to make that, if you wanted to get big pharma interested, transferable on purchasing the small pharma company, as they often do, if they did come up with the small inhibitor of the rare disease drugs.
I think Alexander knows it even better. But yeah, that's the idea. It's a transferable voucher. but please.
Yeah, thank you. So indeed, as MEP Voiculescu mentioned, the new proposed directive includes transferable exclusivity voucher for antimicrobials. So if a company develops and invests in new innovative antimicrobials where we know there is a market failure because there have been no new breakthrough antimicrobials in the past 20, 30 years, actually. And it's a market where, in fact, companies are incentivized not to sell their drug, to leave and not to create antimicrobial resistance. Then this voucher would extend the period of protection of a new, or allow companies that invest in antimicrobials to trade this voucher and extend the protection of another drug or sell it to another company. So kind of looks at the antimicrobial resistant and new antimicrobials market. Yeah, that's what the Commission proposed. The Parliament continued to endorse, and now it's up to the member states to actually find the best and viable solution for them. We look forward to seeing the final text actually and what will be the final version of the voucher. So this is the concept behind it.
Karin, if I may, just for everyone, this regulation in the US is called Creating Hope. And it says if a company put on the market a medicine for severe rare disease, they got a voucher that they can use or sell to another company. And this helps reducing the time the FDA is evaluating another compound. This type of voucher cannot work in Europe because clearly EMA is working on clock time, 60 days, 60 days. So clearly funding a new, and this is what our proposal is to have an addition in the protection, data protection, clinical data protection of a medicine that is approved first in children, really to make this work. But clearly when we discussed very early with the Commission, when they were preparing this, we saw the voucher for antimicrobial and we said, that would be great to have a voucher as well for children with cancer and pediatric drug development. And they said, oh, maybe not. So clearly inventing a new concept, incentivizing in a way, and the fact that it is transferable could be attractive, but then will need to be addressed because there have been a lot of debate about this transferable voucher to another company.
Please go ahead.
So my follow-up on that is that ensuring that it's not just, activating the PIP and going through it a bit and going through the motions, it's actually getting right to the end. Because I do wonder if sometimes projects are open and they're kicked into touch because they've got a license in adults and they don't want to de-risk it completely. They're very risk-averse organisations. So we do have to incentivise them a lot, I would say.
Fully agree. Investigating, doing research in the pediatric space is it's extremely challenging. Various reasons behind that: the small patient population, diverse, fragmented across Europe. As I mentioned, there is an incentive at the moment to have this obligation. With the new rules, with PIP based on the mechanism of action, the challenges to do those PIPs will be even more difficult to meet. So as FPR, we have been asking the Commission to actually recognize the difficulties of doing the scientific research in the population based on the mechanism of action and provide an even stronger incentive. But that has not resonated yet. And we do hope that the member states recognize both the need to do more research into for pediatric medicine, the difficulty, and then valuing that research and recognizing and incentivizing it. So yeah, well, all our hopes are on the next year or so when the council will actually continue negotiating. The pediatric chapter has not been yet discussed in the council. They will start the first reading, we understand, at the end of the month. So it's still an opportunity to have those conversations at national level. And I would only encourage everyone to have them as soon as possible.
Thank you. I already saw there's another question, and then to Vivonia, if we still have the time. Yeah.
Thank you very much. I'm Hugo, I'm from Portugal. I work for the Agency for Clinical Research and Biomedical Innovation. And I would like to ask the panel, namely the member for the European Parliament, his opinion about the cancer mission, because we have not heard about the role that cancer mission is playing in pediatric research here today. We have heard of the importance of funding fundamental research, both from Delphine, from Alexander. Jill also mentioned the role of research and CCA in the comprehensive cancer centers and connecting care with research. And we are at the moment where Horizon Europe program, the funding for the next FP10 is being discussed, as well as the future for European partnerships and missions. We heard about the Draghi report putting more emphasis on research and innovation. And we also learned from the ACT, Accelerate, and something else, that was coordinated by former Ministry of Research, the Portuguese Ministry of Research, Manuel Heitor, that also missions and partnerships should be strengthened in the next program. So this means a lot. You can strengthen by putting more funding in it. You can put it in a more higher political level with more endorsement from European Commission, also discussed at European Parliament, but the future will be. So I would like to hear about the panel, but namely member of European Parliament, about his position on the future of missions, namely mission on cancer.
I'll be very blunt. I will offer the possibility of other panel members, or maybe Mrs. Tilly-Metz to answer. I'm still educating myself on the cancer mission. I still don't have an opinion on this, and especially on what's there to come.
Thank you.
I can add some blah blah, but
no, thank you for the question. I think we need to make a clear follow-up now on the Europe Beats Cancer report. I mean, that is the very important things to do. Not that it is just nice paper that we had, but to really continue working now on what was foreseen. I don't know exactly, or do you mean the mission letter by the commissioner, or because maybe yeah.
Everything in the letter, the commissioner endorses the continuation of cancer mission and all the other missions, by the way. But specifically about the cancer mission, you have also the report by Manuel Heitor group, the ACT, Accelerate, and there's another A that I'm missing, sorry. That was specifically putting up recommendations for the 10th framework program and saying that missions overall should be reinforced. What I believe is important is we should not let all the investment that was made in this political cycle to just go down the drain. So if you label it mission or something else, it's debatable. I can have an opinion, but that's not what I'm bringing here to the table. It's just a continuation of. In the last 3 work programs, the Cancer Mission has, 3 years, the Cancer Mission has funded several projects and pediatrics on pragmatic clinical trials, fundamental research, and other areas. So this is a vehicle that we have, financial, political, and so on, to continue support the pediatric oncology research and care.
If I may just say two things. What is foreseen in the work program, if I may say so, it's not yet the work program, but in the mission letter of the Commissioner of Health, there is the prevention is really put in the focus, and especially the revision of the tobacco directive. So that is one thing that we have in the context of preventing also cancer. Now, regarding innovation in general and research, I think we all agree that regarding research, we need to do better. We need not only to invest more, but we need also to have a better coordination at the European level. And that is something that is really explicitly mentioned. On the way to go there, speaking about the voucher, I'm a little bit more critical because I think there are other ways of fostering the pharma industry and research, not only to the voucher, which is not directly linked necessarily to a specific innovation, but that there is another model, for example, a subscription model, like you subscribe for Netflix, you pay regularly to the pharma industry so they know that there is income for this research or for this project, but you also put some milestones. So really there is more a conditionality. If I give you the money, then you have also to come with results, and the importance of the added value really also of the medication. But that is guaranteed somehow with the voucher now. It's in now the text that it's really a new and innovative. But nevertheless, there are different models now to foster the new medication. For me, the voucher might be one if with clear conditions, but I'm more skeptical to it. But there are other models we should not forget. And I can just recommend, and I stop there, that there is a very interesting study that was done by STOA on how to foster innovation, but not only innovation for a few, because that's what we have in the United States. For example, okay, they are maybe good in innovation, but it's only for a few, but also to guarantee affordability and accessibility throughout Europe for the new medication. And that is another challenge we have to tackle, not only to boost innovation, but to make it also accessible and affordable. Sorry that I jumped in like that, but always happy when SIOP is organizing something. That's why I joined when Anne called me. Sorry for that.
Karina, may I just, one short. You said that we didn't talk about the European BT Cancer Plan.
You did.
No. In a nutshell, the European BT Cancer Plan and the Cancer Mission did put children with cancer under the spotlight. That was their message. And they did. There has been funding, there has been project, better than ever. But what we said today, there are still gaps. And we have been 2 days describing all the gaps that further development of the BCAN plan should address. And I take your point. We would be very keen to have some vision about where it goes in the next 10 years. So it was great, but still gaps to be addressed, and this is what we have to push. Sorry.
I think this was the perfect closing with the vision to close the gaps that we still face. Thank you all very, very much for this amazing discussion. I think we could have stayed here for another hour, and I'm very sorry, but we cannot take any more questions. However, I will hand over to our chairs to close, and later at the reception, the panelists will still be here so we can still address some of the questions. Thank you very much. Anita and Carmelo, please come on.
I think that we have just the role to close, but first let's listen to this video which has been prepared for Microi Heroes.
Μικροί Ήρωες είναι ένας φιλανθρωπικός οργανισμός με ιδρυτή τον Λουκά Φουρλά. Ξεκίνησε τη δράση του ως πρωτοβουλία το 2017 και από το 2021 είναι εγγεγραμμένο ίδρυμα. Στοχεύει στην ψυχολογική και κυρίως στην οικονομική στήριξη των οικογενειών των παιδιών που πάσχουν από καρκίνο και λευχαιμία και νοσηλεύονται στο παιδοογκολογικό τμήμα του Μακάριου νοσοκομείου ή βρίσκονται στο εξωτερικό για θεραπεία. Υποστηρίζει επίσης την ανάπτυξη σχετικά με τη δημιουργία υποδομών, κτηρίων, εξοπλισμού αλλά και την έρευνα που αφορά την καταπολέμηση του καρκίνου. Το Ίδρυμα ενισχύεται από φιλανθρωπικές εκδηλώσεις που πραγματοποιούνται από διάφορους φορείς, οργανωμένα σύνολα, εταιρείες ή άτομα που επιθυμούν να στηρίξουν έμπρακτα τον αγώνα μας. Το Σάββατο πριν από τα Χριστούγεννα πραγματοποιείται η εκδήλωση που έχει γίνει θεσμός. Κολυμπάμε με τους ΟΙΚ για τους δικούς μας μικρούς ήρωες στην ακτή Ολυμπίων στη Λεμεσό. Παράλληλα με το κολύμπι πραγματοποιείται και η πορεία αγάπης κατά μήκος της παραλίας μέχρι την αποβάθρα του παλαιού λιμανιού Λεμεσού. Εκατοντάδες οικογένειες κάθε χρόνο επιλέγουν τους όμορφούς μας σελιδοδείχτες αντί μπομπονιέρας στις πιο σημαντικές στιγμές τους, στον γάμο ή τη βάπτιση του παιδιού τους, συνεισφέροντας στο Ίδρυμά μας. Οι μικροί ήρωες είναι αληθινοί μαχητές της ζωής και τους αξίζει να ζήσουν αξιοπρεπώς και να βιώσουν την παιδική ηλικία σε κάθε στάδιο της. Δεν θα πρέπει να στερούνται τίποτε από άλλα παιδιά της ηλικίας τους και γι' αυτό το λόγο γινόμαστε μια γροθιά για να τα βοηθήσουμε να κερδίσουν τη μάχη με τον εχθρό που λέγεται καρκίνος. Γιατί κανένα παιδί δεν πρέπει να πολεμάει μόνο του.
Thank you. Just a few closure words, because I think that today there was another example that this community can deliver important messages. I think that the time sometimes is still needed. Sometimes when I participate to these meetings, I say that in some way for children with cancer or for rare diseases, kind of Marshall Plan is needed. The Marshall Plan was delivered by the US after the Second World War in Europe to, improve. The Marshall Plan for me is a dedication of resources, of statements, of regulation that children with cancer can be in the focus of. So it's important that, and you have seen that today, SIOP Europe and CCI Europe are here. These are the experts. These are the people where we can build up the new future for these children. Children with cancer cannot wait. And as MEP Voiculescu said, 35,000 children are diagnosed every year in Europe, and 6,000 die of cancer. So time is running, and I'm very confident that these events can speed up the process. And thanks to the parents, I think that this will be a great force. So this is why I just hand over to Anita to say the last words. First of all, thank you very much for being here. Thanks to all the people gathered here. And Anita, please, a few words.
Yeah, very few words. But we don't have to summarize what has been said today. So the very important thing is, as you said, the EU Beating Cancer Plan, the Cancer Mission, is really something what we were looking for, and we achieved a lot. And I also want to take this opportunity to thank Stella Kyriakides. She's not with us today. She was always part of our events, but she has to leave. And it's a little bit, I know it's political what I'm saying, but we are very sad about that, because she was a great commissioner, really having also psychosocial care in her heart. And we also, because she was a big supporter. And we don't know who will come, so it's not clear yet, but we are grateful for what we had achieved, but we will be there. As a community, we will not let it go. We will really stay as we are and really using this opportunity what the EU is giving us, but also Vlad has to leave. But looking at the national level and what has to be done there, we are structured. We have a structure in place as CCI Europe and SIOP. We have national contact points. We know where to go when we are needed on a national level, and we know we have to do more on this. So with this, and thank you for all having stayed so long with us. And yeah, we hope to see you very soon in this afternoon. And thank you for being with us, all the other MEPs like
Thank
Tilly
you.
Metz.
Thank you.
Thank you.
Thank you. Thank you. We have the
reception now.
Yes, last but not least, we have the reception.
Sorry, but we had